Imagine eating proper food every day, but your body still behaves as if it is starving. Food enters the gut, digestion happens, but nutrients fail to reach the body. This condition is called as malabsorption syndrome. And in this video, we'll understand what malabsorption syndrome is. Malabsorption is a clinical syndrome characterized by inadequate absorption of nutrients from the GI tract, resulting in nutritional deficiencies and GI symptoms. Let's understand the bigger picture. Normally, food is eaten, digested into small particles, absorbed through the intestinal lining, and then transported into the blood and lymph. But if absorption fails, the body starts developing deficiencies. For normal absorption, we need healthy intestinal mucosa, proper enzymes, bile salts, and good transport mechanism. Important difference is mild digestion versus malabsorption. Mild digestion means food is not broken down properly. Example, pancreatic insufficiency. Whereas malabsorption means food is digested, but intestine cannot absorb it properly. Now, causes of malabsorption. First major group is intestinal diseases. This includes celiac, Crohn's, Whipple's disease, tropical sprue, and intestinal TB. Basically, these diseases damage the intestinal lining and reduce the absorption. Second major cause, pancreatic insufficiency, conditions like chronic pancreatitis or cystic fibrosis, reduce digestive enzyme, so food is not processed properly. Next is bile salt deficiency. Without bile salts, fat absorption becomes poor. Then comes SIBO, small intestine bacterial overgrowth. Here, excess bacteria interfere with nutrient absorption. Some medications and intestinal surgeries can also affect absorption. Secondary causes include lactose intolerance, giardiasis, radiation enteritis, alcohol abuse, and systemic diseases like diabetes. Now let's understand the pathogenesis of malabsorption. Malabsorption occurs when digestion, absorption, or transportation is impaired. First stage is intraluminal phase. This is digestion phase. If digestive enzymes or bile salts are deficient, food is not digested properly. Second is mucosal phase, the absorption stage. If intestinal villi are damaged, absorption decreases. Examples, celiac disease and Crohn's disease. Third is postmucosal phase. Here nutrients are absorbed, but transport into circulation becomes abnormal. Then comes lymphatic obstruction. Fats fail to enter lymphatic circulation properly. And finally, increased nutrient loss can occur through chronic diarrhea or intestinal resection. All of these ultimately lead to weight loss, vitamin deficiency, anemia, weak immunity, and neurological symptoms. Consequences of malabsorption. Malabsorption affects every system in the body. First is nutrient deficiency. Patient develop protein deficiency, vitamin or mineral deficiency. Second is weight loss and wasting. There is loss of body weight, muscle wasting, fat loss, and growth failure in children. Third is immune dysfunction. Patients become prone to recurrent infections and poor wound healing. Fourth is hematological manifestation. This includes iron deficiency anemia, megaloblastic anemia, fatigue, and pallor. Fifth is skeletal manifestation, osteoporosis, osteomalacia, bone pains, and fractures. Sixth is neurological manifestation. Vitamin B12 deficiency may cause neuropathy, ataxia, paresthesia, and cognitive changes. Seventh is GI complications like chronic diarrhea, bloating, flatulence, steatorrhea, and abdominal discomfort. Other manifestations also include edema, bleeding tendency, glossitis, and chelosis. Now let's talk about clinical features of malabsorption syndrome. The presentation can vary depending on which nutrient is deficient and how severe the malabsorption is. The most common GI symptom is chronic diarrhea. Patients may pass bulky, pale, oily, foul-smelling floating stools called as steatorrhea and usually suggests fat malabsorption. Many patients complain of abdominal bloating, flatulence, abdominal discomfort, and distension. Weight loss despite adequate food is a very important clue. Because nutrients are not absorbed properly, patients gradually develop weakness, fatigue, and muscle wasting. Now let's look at the features caused by nutritional deficiencies. Protein deficiency leads to muscle wasting, edema, and generalized weakness. Iron deficiency leading to microcytic anemia, fatigue, and pallor. B12 and folate deficiency leading to megaloblastic anemia, glossitis, and neurological symptoms. Other deficiencies include vitamin A, D, E, K. Calcium and magnesium deficiencies may produce muscle cramps or tetany. Neurological manifestations include peripheral neuropathy, paresthesia, ataxia, and cognitive changes. Skin and mucosal findings may include dry skin, chelosis, glossitis, and hair changes. Children may present with growth failure, delayed puberty, and poor weight gain. And in severe long-standing disease, patients may develop impaired immunity, recurrent infections, and poor wound healing. So, malabsorption is not just a GI disease, it becomes a multi system disorder because almost every organ depends on proper nutrition. Now, let's come to the diagnosis of malabsorption. It starts with clinical suspicion. Patients has chronic diarrhea, steatorrhea, weight loss, bloating, fatigue, or nutritional deficiencies. So, malabsorption should be suspected. Lab investigations include CBC, albumin, electrolytes, LFT, iron, vitamin B12, D3, folate, and calcium levels. Stool analysis, especially stool fat estimation, fecal elastase, and reducing substances. Imaging endoscopy helps to identify underlying disease. Endoscopy with biopsy is especially important in celiac disease. Functional tests like deoxylase test, lactose tolerance test, breath test, Schilling test. Specific tests helps to diagnose exact cause, such as anti-DTG antibody for celiac or pancreatic enzyme testing. Treatment of malabsorption mainly focuses on correcting the cause, improving absorption, and replacing deficiencies. First, treating the underlying cause. For example, gluten-free diet in celiac, anti-TB therapy in TB, pancreatic enzyme replacement in pancreatic insufficiency. Nutritional support is extremely important. Patients need high calorie, high protein, small frequent meals, and sometimes medium chain triglycerides which are easy to absorb. Replacement therapy may include pancreatic enzyme, bile salts, probiotic, and lactase supplements. Vitamin and mineral supplementation is also essential. Patients may require vitamin A, D, E, K, vitamin B12, folate, iron, calcium, magnesium, zinc, and selenium. Complications like anemia, osteoporosis, edema, infections should also be treated. Complications of a malabsorption. Long-standing malabsorption affects multi-organ system. Patients may develop severe nutritional deficiency, anemia, osteoporosis, neuropathy, chronic disease, skin change, electrolyte imbalance, and impaired immunity. CVS and metabolic complications can also occur in severe cases. If untreated for a longer time, patients may develop poor quality of life, chronic debility, and increased morbidity. So, coming to the clinical pearls, think about malabsorption when chronic GI symptoms persist along with weight loss despite adequate food intake. So, history is the key. Ask about diarrhea, bloating, surgeries, diet, drug history, and family history. Look for red flags such as weight loss, anemia, easy bruising, neurological symptoms, growth failure, and recurrent fractures. Think nutrition. Multi-nutrient deficiencies suggest strong malabsorption. Examine carefully for glossitis, chelosis, skin changes, muscle wasting, edema, and abdominal distension. Always not the final diagnosis. Early recognition and timely treatment improve outcomes and quality of life. So this was malabsorption explained in a simple and easy way. If you found this video useful, make sure to like, share, subscribe to the channel, and comment below which topic you want the next. Thank you for watching.